My name is Lindy Bollen, and I'm the State Oral Health Officer for the Arkansas Department of Health. Today I'd like to talk to you about community water fluoridation, why we do it, and how you benefit. To understand the issue of water fluoridation, we need to go back to 1901 when a young dentist, Frederick McKay, opened his dental practice in Colorado Springs, Colorado. Curious by nature, McKay noticed that a large percent of his patients presented with a dark brown stained appearance to their teeth that he called the Colorado brown stain. What was even more remarkable was, despite the appearance of the teeth, he couldn't find any dental decay. He wrote a few articles about what his observation showed, and it got the attention of Dr. G.V. Black, a well-known educator and dean of the Northwestern University School of Dentistry in Chicago. Black joined with Dean and began some of the early epidemiological studies to determine the cause of this mottled appearance of teeth. In 1931, the Aluminum Company of America had a mining operation in Bauxite, Arkansas. Citizens in this area were showing this same mottled appearance to their teeth, and Alcoa feared a public relations backlash. They hired a chemist, Dr. H.V. Churchill, to find out what was causing this and what could be done to eradicate the problem. Churchill was using a new device at the time called a photospectrographic analysis, and he started analyzing the water from bauxite and all the surrounding areas. What he found in bauxite was a high concentration of fluoride, 13.7 milligrams per liters, or parts per million we'll refer to from here on. But when he compared it to other areas, he was seeing a much lower level. 5 miles away in Benton, their drinking water came from the Saline River, and the concentration of fluoride was 0.5 parts per million. Bauxite was getting its drinking water from 2 deep wells near the mining site, so something was tied to the water. Along this same time, the National Institute of Health was in its infancy as a program to monitor and improve health. Dr. H.T. Dean was set to the task to determine if fluoride was the sole cause for creating mottled enamel and how to overcome this problem. Dean and his colleagues set out to carry out what was called the 21-city study of communities that exhibited this mottled enamel of varying degrees of intensity. Through their analysis, they found that when communities had a fluoride concentration less than 0.5 parts per million, the populace had a 3-fold evidence of dental decay, compared to communities where a fluoride level was 1.4 parts per million or greater. Dean realized that fluoride could provide a preventative service by somehow strengthening the teeth to be more decay resistant. His research changed to seek what concentration level would provide the strengthening effect without resulting in changing the appearance of the teeth, which he now called dental fluorosis. After much more research and comparison, the team settled on 1 part per million as the ideal level for fluoride. A decision was made to see if it was possible to control the fluoride concentration at 1 part per million and see a resulting decrease in decay. Grand Rapids, Michigan was selected to be the host for this grand experiment. Dean and his colleagues showed up to examine over 30,000 school-aged children from Grand Rapids and the control communities Aurora and Muskegon. All factors were considered the same. They were taking their water source from the exact same area. It's just that Grand Rapids water treatment plant was treating the water, raising the fluoride levels to the optimum level, while the others were not. Every 2 years they would return and do a cross-sectional survey to monitor the children and see what results they would develop. After 4 years, they noticed upwards of a 40% decrease in decay within the Grand Rapids children, and by 1951, this climbed even to 65% and higher. Well, city leaders in Muskegon said, we don't want any more part of this 15-year program. We want the same benefit for our children. They dropped out of the program, and then they started their own community water fluoridation system. The Public Health Service and the American Dental Society was very excited about this because finally there was something that was simple and easy that could help to address the prevalence of dental decay that was simple and easy for people to use. How does fluoride work? Fluoride benefits through two different mechanisms. The first is through systemic or the ingestion of fluoride. This happens as the teeth are being formed early on, even in utero. The teeth buds are already present for the baby teeth, and by birth, many of the buds for the permanent teeth are already in position. The systemic ingestion of fluoride, whether it be through water or consumption of food, the fluoride gets within the body system, and it has an affinity for calcified structures within the body, such as the bones and the teeth. The dental enamel is the hardest substance in the body, and there's where the fluoride item settles. It makes the enamel even that much more stronger and more resistant to acids that happen when bacteria starts breaking down food. The second method of benefit is called topical or direct contact to the tooth surface. This happens through the use of fluoridated toothpaste, swishing with fluoride rinse when you go to the dentist and they clean your teeth with the polishing paste, even when drinking fluoridated water. Fluoride ions are introduced into the mouth. It bathes the surface of the teeth, and this is something that works throughout the entire life cycle. Fluoride has been well researched for over the last 70 years. There's over 3,500 or more scientific articles that have been written on fluoride. It's looked at parameters from cost to health results to are there any links. There has not been one credible health organization that does not endorse water fluoride as a proven health preventative measure. Communities that don't do fluoridation now still actually benefit from what's known as the halo or diffusion effect. Food and beverages that are made in fluoridated communities are using water that already has fluoride in it. Those food and beverages are then shipped out nationally into areas that may not have fluoride in their water, but they are still accepting fluoride through this indirect method. So citizens are even enjoying the fluoridated effect even in this diluted measurement. There are over 35 various chemicals that are added to treat water to make it drinkable. The Council of Public Health Consultants is tasked with protecting the public from harm. They work with the National Sanitation Foundation to create the NSF ANSI Standard 60, the Drinking Water, Chemicals and Health Effects paper. This set the guideline that ensures the purity of all additives that go into water to make sure that it meets the standards required. This process is an ongoing process of recertification, even from the same company. Each shipment that comes in still has to be certified. This is just a protective measure to oversee and ensure health. It is the EPA that sets the contaminant levels of acceptability for water additives. Through Dean's research, it was determined that 4 parts per million was the concentration that would lead to noticeable dental fluorosis in a population. The EPA set the maximum contaminant level at 4 parts per million. Any water system that is naturally fluoridated at 4 parts per million or higher is required to remove the fluoride before consumption. This removal process is called reverse osmosis. To allay the fears, the secondary contaminant level was established at 2 parts per million. This is not an enforceable measure, but water systems at this level are required to inform their customers that an increased likelihood that children could develop dental fluorosis if too much fluoridated water is consumed. The Department of Health and Human Services recommended the optimal level of fluoride to be lowered from 1 part per million to 0.7 parts per million back in 2011. This was based due on the effect of what we mentioned earlier, the halo effect, and the more readily accessible availability of fluoride. The EPA made that transition to 0.7 parts per million in April of 2015. It has been estimated that for every $1 spent on water fluoridation, there's a potential savings of $38 due to the decreased need for restorative treatment. The average cost per person varies based on community size, but it is estimated to be 50% less than the cost of a single simple restoration. This can be a savings into the millions of dollars when looking at the savings to public health insurance such as Medicaid. In Louisiana, a study was conducted to compare restorative costs between fluoridated and non-fluoridated communities. The conclusion of the study showed children in the non-fluoridated community had twice the amount of decay, were 3 times more likely to be hospitalized for treatment, and those restorative costs were 5 times when compared to children in a fluoridated community. The CDC has heralded water fluoridation as one of the top 10 public health achievements in the 20th century. The overwhelming body of credible scientific evidence has proven water fluoridation to be a safe, effective, and economical method to deliver a preventative benefit to people regardless of age, gender, socioeconomic status, education level, or their ability to even get access to care. And what started off as a modest public health measure has turned into one of America's longest-running political melodramas. People who are opposed to fluoride are strongly entrenched in their belief. Reasons for opposition range from government control, mass medication, claims of creating the AIDS epidemic, the rise in hip fractures, the association of cancer. The list just goes on and on. None of these allegations have been made against fluoridation have been proven to have any validity whatsoever. Yet because of the ease of internet access and social media, the anti-fluoride people continue to promote misinformation in an attempt to discredit fluoride as a preventative service. The only known effect to the exposure of too much fluoride in the concentrations used in public water systems is the development of dental fluorosis. Even at the secondary contaminant level of 2 parts per million, the likelihood of fluorosis is very low and most likely only noticed by a dental professional during an examination. What Dr. McKay first noted in 1901, the Colorado brown stain, has led us to the realization that fluoride can provide a beneficial service at the correct concentration. With the correct current level of optimum fluoridation set at 0.7 parts per million, it would be a rare occurrence for dental fluorosis to be noticed. Even so, the teeth are not damaged, they're only stronger. It would be naive to think that water fluoridation will stop dental decay. Water fluoridation helps to strengthen enamel, which in turn makes teeth resistant to the acids from bacterial attack. It is still advisable to brush teeth with fluoridated toothpaste twice a day for 2 minutes at a time. This allows the topical application of fluoride while at the same time mechanically removing debris from the teeth. Seeing a dentist for regular dental cleanings also helps to keep the teeth and gums disease-free. Community water fluoridation provides benefits throughout the life cycle. From young children to older adults, there's a decrease in the incidence of dental decay. I thank you for this opportunity to visit with you today, and I open the floor for any questions.